Hello all. My final presentation is on advocacy for dementia care improvement, and this is for the Nurse 6010 Health Policy Practice and Ethics course. So let's talk about the problem and significance within the dementia population. At least 9 million Americans suffer with some form of dementia. The most prevalent form of dementia is the Alzheimer's form, with 5.8 million Americans diagnosed, so more than half of the overall total diagnoses are Alzheimer's. So another way to look at that is for every 9 people that are over the age of 65, at least one of those people will have Alzheimer's dementia. Because of the safety issues dementia patients face, such as forgetfulness, as well as decline in overall health as that disease progresses, dementia patients usually require a caregiver around the clock, or often they may end up in an institution, so some sort of facility for 24-hour care. Patients that are at home, the Alzheimer's or any dementia patient that is at home, often their caregivers are their unpaid relative, and that relative is carrying the burden of providing that 24/7 care. Those caregivers may face burnout, burden, and managing side effects of the dementia patient. We all know that dementia patients could have behavioral outbursts as that disease progresses. In 2020, Healthy People released a projection for the year of 2030 of what they kind of wanted to work on over the next 10 years in regards to health within the United States. So that report, Healthy People 2030, they have an initiative to target the dementia population, try to figure out what resources are available, what resources are needed to specifically help this vulnerable population. So Healthy People 2030 reports that dementia patients are at higher risk of institutionalization, and we all know that that drives up the healthcare cost. So some form of insurance, out of pocket, it's more money for Americans to be in an institution versus at home. According to WHO, dementia cost economies globally $1.3 trillion in 2019. So it's very prevalent. It's a high cost disease. It's high cost toward the end of that disease to care for these patients in the community or in an institution. It just requires a lot of effort, and there's not many resources available. So considering current health policy, I narrowed my focus down to what policies are driving the Medicare covered services and reimbursement and Medicaid covered services and reimbursement. I did that specifically because there's a plethora of different Advantage plans out there that offer different levels of services and care to their consumers, and then Medicaid is different by state. So when I was researching Medicaid, I was thinking more along the lines of North Carolina Medicaid, just because that's the population that I'm looking to try to help within this program. And specifically, just wanted to look at these two because to qualify for Medicare, generally, patients 65 or older or disabled, and we know that dementia oftentimes is within that population. So that's kind of why I narrowed my focus down to insurance and what policy drives those and the coverage. So currently, there's not many resources made available by Medicare that I could find that are specific to caregiver support and education. So we know that dementia patients oftentimes at end of life, they're in the home or they're in the institution because their disease requires 24/7 care. So just considering that caregiver and what support they need. Medicare does not cover long-term institutionalization. Medicaid will, under certain criteria, so it may cover long-term institutionalization, so that's like a SNF or something like that, or a dementia care unit. The other thing that I wanted to point out was the personal care service, which is a aide and attendant, personal care assistant, so a CNA type care that can come into the home a couple hours a day, several hours a week, however that care plan is developed, to be able to provide care for that patient, for the dementia population, for their patient, several hours a day. Again, helping them with ADLs, IADLs, making sure patients safe. That is a service that is covered only under Medicaid. In the state of North Carolina, it is, and that is a resource for caregivers if the dementia patient qualifies for that. That gives that caregiver time to get away, to go do their errands, go grocery shopping, pay bills, handle their own affairs, go to work. That is the type of service that I wish our Medicare population had, because those caregivers face the same challenges and they need the same resources, right? They need breaks, they need help so that they can continue their life and go to work to be able to pay the bills and things. But so oftentimes caregivers are trying to pick and choose. Do I stay home and care for my loved one? Do I put them in an institution type setting, in a facility? So it becomes a burden oftentimes and creates a lot of stress just because there's lack of resources. I did also want to point out that currently there's no care management programs specifically targeted to the dementia care population, or there wasn't when I began doing this presentation at the beginning of the class. However, I do believe of recent there was a program called Guide that has been released that may be targeting this population. But again, when I was doing the project, there was currently no care management programs. And care management, what that does is it's a care navigator, a nurse, or social worker, or some kind of health coach that helps that patient or whoever their consumer is kind of know what resources are available in the community, help them get referrals out, ensuring that those referral sources are meeting their needs, just connecting people to their community, to their providers, ensuring continuity of care. So that's not currently active right now. I think there's something in the works at the federal level, but it's not currently active. So in considering the dementia population and what barriers that I feel more inclined to try to help advocate for, I wanted to specifically focus on caregiver support. Just because I see it in our community, I see caregivers caring for their loved ones at home, the burden of trying to decide, do I put them in an institution, like a placement in a SNF or something similar, dementia care unit, or do I keep them at home? But if I keep them at home and I care for my loved one at home, what resources are available? And that's financial, that's emotional, just what support's available. And I feel like that's a huge area that doesn't get as much focus as other advocacy avenues. So that's why I did some research, and I did find that in 2023, the United States 118th Congress, Senate, introduced Bill 626, which is Comprehensive Care for Alzheimer's Act. The bill, if passed, would allow funding from federal government to provide better care for those suffering with dementia in the United States. So that funding would help go toward developing a care management program. So within that care management program, dementia patients that have Medicare or Medicaid, they would be eligible to have a care manager. And that would be a social worker, that could be a nurse, it could be a community health worker. I guess it would be however they would, whatever criteria the government would stipulate for that position. But the goal of that care manager is to be a healthcare navigator. So basically, finding out what resources are available in the community, um, making those connections, making sure that the patient and their caregiver, that they're connected to those resources, that their needs are being met, um, helping connect them to things like respite care, helping them obtain medications. So not only obtaining it, but also following up and making sure there's no barriers to adherence. So by doing that, you're promoting quality outcomes. So they would, again, be coordinating care, monitoring the health status, monitoring environment for safety, because, again, as dementia progresses, the environment has to be a safe environment to prevent any kind of harm or things like that. Um, Social determinant of health needs, so that care manager would be helping advocate for things like housing, transportation, again, financial assistance to help pay for meds, food, clothing. It would also include caregiver supports such as education, respite, and any other linkages that are specific to that caregiver would need. The whole idea is that if we fund a care management program and there's somebody that's helping that patient and their loved one stay connected to their community resources and having their needs met, that patient can stay in the home and be cared for. Again, that promotes quality of life. It allows that dementia patient to be at home with their loved ones. It allows that caregiver to spend more time with their loved one. It keeps that dementia patient out of an institution, is the whole idea. And ultimately, that kind of gets to the triple aim of healthcare, which is lowering the cost of care, because it does cost more to have someone in an institution than it does at home. It's very expensive for somebody to be placed. It promotes quality outcomes because we're going to be providing teaching, resources, education, assistance with meds, assistance with transportation, getting that patient to the doctor, and things like that. So that's how it could promote quality outcomes. And also, there's just a satisfaction overall. When people are connected to their resources, when they know they have somebody they can call to help them answer questions, or, hey, I have some food insecurities. Do you have any resources that we can get some meals? And somebody on the other line is going to truly make that human impact, that human connection to help them meet their needs. Ultimately, that's where you get that caregiver or patient satisfaction. So if this program, again, would be passed, the funding would be for Medicare. So dementia patients that are on Medicare, and also it would allow funding at the state level for the state Medicaid programs. There are no identified unintended consequences if this bill would be approved. Um, it seems to be very equitable in that any dementia patient that has Medicare or they qualify for their state Medicaid plan, they would be eligible to have this resource available. The only question that still is, I guess, unanswered, and the bill hasn't progressed enough to know to be able to answer the question, is where would the funding come from? So we know it would come from Medicare, it would come from the states, it would come from the federal government. But if we are going to pull millions or billions of dollars, I would assume, into this specific care management program that is going to be across the United States, where does that money come from? Does it mean something else will be defunded? So that's kind of still the question that is out there, is how would this even be funded and what would that look like? What implications would it have on other initiatives that may be going on at the state level or at the federal level? The priority action steps are, though, to continue to advocate, because I feel like this is very much needed. We have across the United States and specific to North Carolina, we have care management programs that exist. So we have care management programs specifically for disabled adults, for children. You have chronic care management. You have transitional care management. You have behavioral health care management. So you have all these programs that are specific to vulnerable populations. So this would just be an addition to that global initiative to connect people to to resources, just to help them be successful, to help them be more proactive with their overall health instead of in reactive state. And doing an analysis of who would be in support of this bill, who would oppose it, and then their influential level, I did discover that several stakeholders exist who would have interest in this bill being enacted. As you can see here, this is a power map that shows quite a bit of folks that are in support of the bill and have a lot of what I felt like would be a lot of influence. I did reach out to a lot of these folks that are listed here, these stakeholders. I reached out to some House of Representatives, left messages. I reached out to our senators in North Carolina, and then I also emailed with the Alzheimer's Association. Unfortunately, I was unable to get any return calls back from any of our representatives at our state level, but I was able to connect with the University of North Carolina, Chapel Hill School of Medicine, and I got to talk to Dr. Busby Whitehead, and she is a doctor of geriatrics. She specializes in geriatrics. She's a professor at the University of Chapel Hill, but also she is the chair of this Carolina Geriatric Workforce Enhancement Program that is managed, is a part of UNC Chapel Hill. So she has a team of folks that include other doctors, pharmacists, social workers, and what they do is they pursue grants and funding within the state of North Carolina, um, and then they connect with organizations within the state to provide training, to provide resources, or whatever's needed for the population that specific population that they obtain the grant for. But they all specialize in geriatrics, so their population for everything that they're doing is in the older population. So I was able to talk with them just about dementia care and this bill, and that conversation kind of led into some other things about grants and funding that could be available specific for North Carolina. But ultimately, um, that team agreed that they were in strong support of this bill being passed. They see the need for it, and they do have a moderate amount of influence just because of the level of advocacy that they already have for geriatrics. So I thought that was really interesting to be able to talk with someone who wasn't really a legislator, but it was a organization, an entity that still has influence over the vulnerable population. I did just want to point out real quick that there were um, two senators that I felt would probably be in opposition of this bill being passed, just based on when I was doing my research, I was looking at what committees they were part of, their past voting history, and Senators Norm Sanderson and Senator Eddie Settle were identified as potential opposers just based on their prior voting history on additional programs that would allow for more healthcare funding, specifically Medicaid expansion. Both of those senators voted no for that. So I just felt like they would probably poke a lot of holes in this bill or have a lot of opposition. Um, I did also just feel like potentially dementia care units would be in opposition. They're not, again, it's not a legislator, but it's still organizations that could pull together, that could lobby in opposition, just because the goal of this bill, the 626 bill, would be to provide funding to keep patients at home. So if we're keeping them at home, that means they're not being admitted into the dementia care unit. So if you're looking at that from a business standpoint instead of a quality standpoint, it could be viewed that that bill could affect their bottom line, so they could be in opposition. So just to conclude, dementia is a very costly syndrome. Some call it a syndrome, some call it a disease, but it's a very costly disease, and it creates a progression of decline and can lead to caregiver burden. Data predictions allude that dementia prevalence will continue to increase over the next decade. Again, we're sitting at 9 million Americans right now that have this diagnosis. So as people live longer, we know that they live longer, we can deduce that the dementia population will just continue to grow. And because dementia symptoms result in declines that impact the patient's ability to care for themselves, caregivers often end up caring for their loved one at home, or the dementia patient is institutionalized for ongoing care. Caregivers are faced with burnout, other burdens, making decisions about finances and other things that I've mentioned as they try to provide for care for their loved one. A dementia care program, so that care management program, could be successful in promoting health literacy, caregiver support, and it could decrease cost of care. Senate Bill 626 was introduced in the 118th Congress to promote Medicare funding in support of dementia care management programs for Medicare patients, and then also allow funding for the states for their specific Medicaid programs. And then the Carolina Geriatric Workforce Enhancement Program is who I contacted, that was in strong support and had the most influence in those that I reached out to and was able to connect with, that could help get this bill pushed along further so that it can be enacted and ultimately provide more care, more resources to our dementia population and their caregivers. So ongoing efforts will be to continue advocating, reaching out to legislators and other stakeholders just to see if we can get some more traction in getting this bill some more support and get it moving along.